Ketorolac, common trade name for that is going to be Toradol. It is an NSAID analgesic, non-steroidal, anti-inflammatory drug. Mechanism of action, COX inhibition and prostaglandin synthesis, producing analgesic, antipyretic, and anti-inflammatory effects. So that's a very brief overview of how it works. Pregnancy class for it is C. So indications for it: short-term pain management. It is ideal for kidney stones. Contraindications is going to be salicylate or NSAID sensitivity, renal failure, bleeding disorders, pregnant patients, and patients with a history of asthma. And probably go ahead and put in there most pediatric patients as well. So it is an NSAID and is similar to aspirin, and so that's why we need to be careful with giving with patients with a bleeding disorder, as it can affect the clotting cascade and the way our body is able to stop bleeding, and so that's why we don't typically use it with trauma as well. Adverse reactions: increased bleeding, drowsiness, dizziness, headache, dyspnea, vasodilation, nausea, vomiting, and then either hypo or hypertension. Either one of those is possible. Some drug interactions to think of: it could cause some increased bleeding with patients that are already taking other anticoagulants. Typical adult dosing is 15 to 30 milligrams IV or 30 to 60 milligrams IM. For the kids, typically not recommended for Reye's syndrome. Remember, aspirin's the same way. We don't give it because of the possibility for Reye's syndrome. Duration of effects: onset starts working about 10 minutes, takes or peak effects in 1 to 2 hours, and it lasts in the body 2 to 6 hours, somewhere in there. Use caution with trauma. Again, like we mentioned, it can cause some bleeding issues. And then any of the older population that we're going to give it to, we want to typically reduce our dosing in half. And it's just the way the body is excreting the Toradol and through the renal system, and it can last longer in the body. That's why we want to reduce the dosage.